Good morning, everybody. Thanks very much for joining me today. Nice to see so many Manitobans enjoying the beautiful Manitoba weather this past weekend. Incredible number of folks out with their kids, with their pets, with both on the walks, on the rivers of our beautiful city and province, using this time to protect ourselves carefully from the potential of COVID, while at the same time enjoying winter here in the heart of the country, the Keystone Province. So just remind everybody, continue to do that, and please remember to wear a mask in public places, keep your distance, and just socialize with members of your household. Our number one priority is going to continue to be, as it has been throughout this pandemic, to protect our most vulnerable citizens. We want to ensure that our healthcare system is there for all of us. Pleased to see some additional movement now to provide surgeries to people who've been waiting patiently for those. And there's progress being made, and it's all thanks to you. So congratulations for doing the things that have to be done, doing your duty. We are also focused as well on recognizing the needs of our business environment. We want to see our business people succeed, but we know now that that is very difficult through these times of restrictions. Our business community will be able to safely reopen at some point in the future, and we hope able to stay open as well, but that's all in our hands, and that all depends on our willingness to do the right things that Dr. Roussin has been advising us to do. The best thing we can do to help our local businesses, besides shop local when the next opportunity presents itself, is to make sure that we bend our COVID curve down and that we keep it down. And so thanks to Manitobans for doing that. So on Friday of last week, on the advice of Dr. Roussin, our public health experts, it was announced by Dr. Roussin that all of Manitoba will remain at the red critical level on the pandemic response system for an additional 2 weeks. And this would be while public health officials are monitoring possible increases to case numbers as a result of the holiday period. Remember that holiday, the incubation period of our virus is such that we're not out of the woods yet. Recent days have given us some reason for optimism, but we need to remember that COVID is nefarious and sneaky, and that it will get back into our people if we're not careful. So thanks to Dr. Roussin again for his work and for the work of his team. Their health expertise has been incredibly important in our response to this COVID pandemic, and so we all say a sincere thank you to he and Lynette Siragusa as well for their regular communications with Manitobans throughout this time. Thanks to Manitobans, the current restrictions, which are in place, as I said before, until January 22nd, are working. And they will continue to work with the cooperation and the dedication of all Manitobans. Compared to other Canadian jurisdictions, I have the Statistics Canada numbers week over week, and they show that west of the Maritimes, the numbers are these. In Canada, the West Coast is experiencing an increase week over week of 11.9%, Alberta 6.7% up, Saskatchewan 27.2% up, Ontario 36.4% increase, Quebec 13.2% increase, and here in Manitoba we are down 19.2%. This is not a victory lap. As I've said many, many times before, this is a marathon, it's not a sprint. And we are cheering for all our Canadian friends and neighbors to get COVID under control there too. And we will continue to hope for the best in other jurisdictions. But we must remember to do the right things here, and I thank Manitobans for doing the right things. We recognize that you are making significant sacrifices. We also recognize that you are saving lives. And the projections that we had from our senior health officials just a few weeks ago tell me that because of what you're doing, we have saved already hundreds and hundreds of Manitoba lives. That's because of you. And so here in Manitoba, we have not had to endure to the same degree we would have without these restrictions, as hard as they are, saying goodbye to so many precious people. Hundreds of Manitobans' lives have been saved by their fellow Manitobans. Thank you. We recognize these sacrifices that you're making. We recognize in particular that our small businesses are critical to our economic recovery and to our ongoing economic success, and they have in particular been hit hard as a result of these restrictions. They are the folks who provide jobs to our children and grandchildren. They are the folks who provide the services we count on, the goods we need. But they haven't been able to do that right now the way they'd like to, and that's been hard. And so that's why we've designed support programs from the beginning to fill those gaps, to help them get through this difficult time, tremendously difficult time. And that's why today I'm confirming that we are proceeding with our Bridge Grant Program Part 2. And this will be to all Manitoba businesses, nonprofits, charities that have been forced to close their doors or have had significant demand for their business impacted and reduced as a result of the critical level red public health restrictions. On November 10th of last year, Manitoba Bridge Grant was first announced and provided $5,000 to all relevant businesses up front. Limited red tape to get the money out to those businesses to help them through this time. We'll never make up for the profit opportunities that have been lost and the hardship emotionally, psychologically, to those folks who have dedicated themselves to their businesses. We know that, but we also know that some support is essential, and we have offered these programs, and they are the most generous in Canada for our small businesses. In early December, we expanded the Bridge program to include home-based businesses as well. They didn't need to operate a storefront to apply. And when I announced this program at the first, I said this was intended to bridge through to the end of the year. But if we had to continue with our restrictions in the new year, we would offer an additional $5,000 payment for a total of $10,000 in direct financial support. The public health orders continued into the new year, as Dr. Roussin had advised they should. And so as a result, our government is keeping its word. And on Friday, we sent out an additional over $50 million to Manitoba small businesses. Payments have been made. Businesses have been notified of their deposit. To date, our Bridge Grant program has supported more than 10,000 Manitoba businesses for a total of over $100 million in support. That includes, just to break it down quickly, $94 million to over 9,400 storefront businesses and roughly $10 million additional dollars to 1,300 home-based businesses as well. But we want to go further to offering supports to our Manitoba small businesses, and today I'm pleased to announce two important measures. One, to make sure that people don't fall through the cracks or, for whatever reason, miss the opportunity to apply for these supports that are so important to them, we're extending the application deadline until the end of January, so January 31st. So, ladies and gentlemen, if you're in a small business, you feel that this is a program that you need the support from, I encourage you to get your application in now. You have till the end of the month. Previous deadline was the end of the year and it had passed, but we do think it's important to allow folks to not slip through the cracks. Secondly, we are going to expand the eligibility to offer financial support and protection to more small businesses in Manitoba that are affected adversely by the current and continuing public health orders. So today, I want to be clear to all hotels, resorts, lodges and outfitters, travel agencies, janitorial services companies, and licensed owner-operators of passenger transportation businesses that they too can apply and that they too will be eligible, not just for the bridge grant for this year, the $5,000, but they'll be eligible to apply, and if qualifying, they will be eligible for retroactively the previous $5,000. In other words, for a total potentially of an additional $10,000 of support to these additional businesses. For a full list of criteria and to apply, visit manitoba.ca/COVID-19, click on Programs, and then click on Manitoba Bridge Grant. For assistance in completing the online form, applicants can also contact the Manitoba Government Inquiry Line at 204-945-3744 or toll-free at 1-866-MANITOBA. We're advancing this financial support now to help bridge our businesses through these restrictions. We're all optimistic that as we get these vaccines online, and I understand the vaccine group has more detail to share with you in a not too distant future, we're all optimistic about that. But 2 points. One, the vaccine isn't here yet. Remember that we're only going to get enough in Manitoba for about 1% of the population by the end of this month. Approximately 2% by the end of February. Less than 10% of folks will be vaccinated in the first quarter under the current federal delivery schedule. So we're not out of the woods yet, as Dr. Roussen's fond of saying, but we are optimistic. We're optimistic that our small business community can bridge through this challenging time, that they'll be stronger for it. And let's remember that many small businesses have adapted so well that they've found the potential to keep their services going and even expand them through this time. But for those that have had troubles, we are there to help you, and this is the support I'm announcing today. Our government remains committed to delivering the right programs at the right time, and I say again, we're dedicated to helping individual Manitobans, family-run businesses, not family-run businesses too, through these challenging times. We continue to offer the most generous support programs in our country on a per capita basis. Our programs are broad-based. They're easily accessible. Many other provinces have programs that require you to submit significant amounts of records, go and see your accountant, demonstrate that you've had a significant impact before you're eligible for anything. Our programs are applied for and approved over 90% of the time, and most within a very short period. Our government's committed so far over $400 million in COVID support specifically for businesses. This, again, per capita, is the largest funding commitment in Canada, bar none. This bridge grant is one example of that. These bridge grants, I should now say, but also our gap protection program, which preceded us. The back-to-work wage subsidy programs are the only ones of their kind in Canada. And other measures, such as the elimination of the provincial sales tax on property insurance that have helped many businesses with additional cash, MPI rebates, workers' compensation rebates, and there's a significant additional list. And even more programs are in the planning stages as we speak and will be announced as needs continue, should we need to continue with the economic restrictions further. The best thing we can do for our businesses, our healthcare system, our schools, our vulnerable communities, our loved ones, is to bend the COVID curve down. We did it once, we can do it again. We need everyone on Team Manitoba. And as more vaccines arrive and we are able to immunize even more Manitobans, I continue to remind all Manitobans to follow the fundamentals. Stay home, only leave your home for essential purposes. Stay home when you're sick. Stay home if any member of your family is sick. Don't socialize with people outside your household. Wash your hands. Cover your cough. Practice physical distancing. Wear a mask. And when the cold weather comes, which sadly and inevitably it's going to, remember to wear a toque too. Keep yourself covered up and layered and get outside. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning, from the Canadian Press, Steve.
Premier, I'm wondering if you can tell us with this new expansion of the bridge grant to other businesses, some of them are not shut down completely. Obviously, they've been affected by the restrictions, but some of them are continuing to operate, hotels and the like. So, what is the formula for their aid if they're continuing to operate but on a restricted basis?
Steve, I'll get you the format, but let's be clear. Because we have, as you know, in Manitoba, we've got thousands upon thousands of businesses, and each one of them is affected to some degree, potentially differently than the other. There's obviously a evaluative process that has to be brought to bear. But let's be clear, and I use the hotel industries. Ottawa, for example, has announced support for the hotel industry several times. Hospitality industries more generally, as recently as Minister Freeland's announcements just a few weeks ago, but we have yet to get clarity around their programs' definitions and qualifying standards. So the idea here is to advance some funds that are needed now to, for example, you referenced the hotel industry, to assist them in this time, and we're also urging, my ministers and I are urging Ottawa to come forward with clarity around what are the supports that they are actually offering. They've talked about them, but we're not clear on what they are yet, and we need that clarity. We've always tried to design our programs to work mutually with Ottawa's, to work cooperatively in support of their programs. If there was an absence of support, we tried to fill in the gap there. In this one, we felt it was past time waiting, and we wanted to expand our programs to include some more businesses. Even though Ottawa has said they're going to assist them, we can't continue to wait for the detail from them.
And the Prime Minister announced this morning that the federal government has secured purchase for another 20 million doses of the Pfizer vaccine. That's a big jump. It brings the total to 80 million. Are you at a point where you can say what this might mean for Manitoba's plan to roll out the vaccine? Does this speed things up in terms of how many people we can vaccinate by summer or fall?
Well, as I said to you last week, our capacity to administer vaccines far exceeds the vaccines that we have. We have the ability, I'm told by our vaccination team, and you could get more detail from them, of course, their next press availability, but I've been told by the end of March that they would be able, if we had unlimited access to vaccines, they'd be able to ramp up our super sites, for example, and our other mechanisms so that we could get vaccines into every Manitoban in that time period. So any word of additional vaccines from the federal government is very much appreciated. We thank them for that. If I could, speaking of federal, I wanted to offer my best wishes to Jim Carr on his reappointment to Cabinet, and say I wish him all the best, as I have several times in the past. I continue to wish Jim well in his recovery and his health challenges, and I know that we're all pleased to see him able to resume his duties at this point in time. So congratulations to Minister Carr.
From CTV Winnipeg, Josh.
Good morning, Premier. I'm just wondering if you can tell us whether or not you have a time frame in mind as to when you would like to see some of the restrictions eased to allow businesses to partially reopen, given the Bridge Grant was extended until the end of January. Would it be like a February opening? What would you like to see?
What I'd like to see is a sustainable reopening that doesn't have to go jumping around back and forth, yo-yoing around based on weekly results. So there may have been, it seems there was some misunderstanding on some of my comments with one Free Press columnist. I'll just simply say, I've always said this is a marathon, not a sprint, and I've always said we're in this together to make sure that we can reopen safely and sustainably, and I think that that's the mechanism we should be pursuing every single day.
As a follow-up, I'm just wondering if you can explain what, if anything, would happen to businesses who received the Bridge Grant or who are applying for it but have been fined or have defied public health orders by reopening to get things going again.
Well, we're trying to support businesses, I guess, in some cases, whether they like it or not. So I read the report today, as you did, about one particular tattoo parlor that's disappointed that we have health orders and that we're enforcing them. We're going to continue to enforce our health orders because that's the best thing to do to help our businesses get back reopening. That's the best thing to do in order to keep COVID curve down. We want to do that. That's the best thing to do to help that business person and every other business person reopen sustainably, and that's what they want. In the meantime, we'll continue to offer these supports to those companies, and we'll continue to fine them if they break the rules. So they may have to use some of our Bridge Grant to pay their fines, I guess, but that's sad, but that's the nature of how it's going to continue to work.
From City News, Mike.
Good morning, Premier. So the Manitoba Body Art Association, whose businesses provide tattoo and permanent cosmetics, have sent emails and made calls to your government looking to try and get opened up right away, as they provide services they argue are essential. Are there any discussions amongst your government about making businesses like this essential and opening them up prior to lifting lockdown?
Absolutely not.
And I guess for my follow-up, can you elaborate? Because they would probably argue that they would remove body modifications for MRIs, and then provide like tattoos, areola tattoos for breast cancer survivors. What would you say to that?
I would say they can make their case to Dr. Roussin. He's been eminently clear that this isn't one of the areas of essential services that he's interested in reopening at this point in time. But I know that he and I are happy to receive interventions from any group, any number of people, and we have. Our MLAs, our cabinet ministers are in receipt of not a small number of interventions of that nature. But I would suggest to that association that they use the Engage MB website because it's been used very effectively, and we've listened to the input we've received. But at this point in time, no. Dr. Roussin was really clear. He just announced restrictions that are going to continue on Friday. And so I don't want to give false hope to anybody in the tattoo business that that's going to change as a consequence of anything but health priorities. And those are Dr. Roussin's considerations and all of our top priority, I hope.
From the Winnipeg Free Press, Larry.
Premier, you've expressed frustration at the lack of vaccine supplies from Ottawa, but Manitoba continues to lag most other provinces in Canada when it comes to the ratio of vaccine doses administered to those received. Why is this, and is it because the province still lacks a provincial director of immunization?
Well, there are two problems with your assertion there, Larry. First of all, I would like to make it really clear that the position that was advertised is for someone to come in and replace people who've already been doing that work and do it on an ongoing basis, who are internally going back to their roles in other healthcare areas. So the team that has designed our vaccination plan has been hard at work, and I'll continue to praise them. Your paper put in a headline, and I know you don't write the headlines, Larry, that I was bragging. Last, I wasn't bragging about me, I was bragging about hundreds of civil servants that have been working their tail off day and night to design and implement a vaccine strategy for Manitoba that's really, really going to work. And I'm excited about that. So the capacity for us here in Manitoba to deliver way more vaccines than Ottawa, and it's not a knock on Ottawa, that's not the knock on Ottawa, is that they try to blame provinces when vaccines don't go out. That's a real big mistake on Ottawa's part. Let me be clear here. We've focused on designing a plan that we can ramp up so we can get our vaccines out in a matter of weeks. If they can give us more vaccines, we're ready to do that. The argument that there aren't as many out as in PEI is simple to understand if you think about it. First of all, Puckatawagan is not PEI. We're delivering a significant percentage of our vaccines to northern and remote communities. Second, and that means there aren't as many going out right away. Secondly, we've designed a process that involves Indigenous consultation and reconciliation is being put into action here in Manitoba, which other provinces have disregarded or don't feel is important. I feel it's very important because as we move forward, we're going to work as partners with our Indigenous leadership and health leaders. That's what we've been doing. That resulted in some delays, for sure, in getting vaccines out. Those are short-term problems. Remembering we only get 1% of the vaccine by the end of this month. So we got to get our systems in place. Thirdly, we just opened, 1 week ago, our super clinics. And we'll have more to say on other ones coming up very, very soon. So, you know, I bristle at the suggestion that somehow Manitoba's planning, done so intensely over such a long period by so many civil servants, is not good. It is great, and it needs to be understood to be great. I would also say that out of caution, we followed the advice of holding back second doses, in reserve at the advice of the manufacturers, where many other provinces did not, Larry. And I think that's a really important thing to understand. Where many other provinces said, let's just get the stuff out quickly in as many arms as possible. We said, let's make sure our supply chain is strong. Let's make sure that we can get the second dose because the manufacturers are saying you have to have that second dose for it to be the most effective it can be. In other words, that makes it look like we're not getting the vaccine out when in fact we are getting it out, and we're making sure we have a reserve to get it into the second time, because the second time is when it's most effective according to the manufacturers. Other provinces are putting it into all their emphasis on the first dose. Some of them are even strategically planning to continue doing that and ignore the second dose and delay putting it in. Manitoba's not following that. That's not our current strategy here, based on the health advice we've received from the national health leadership and from the companies who made the vaccines themselves. So there's your long explanation as to why this false statement that filling the position, which has been filled internally already for very effectively for quite a while, is somehow a sign of lack of organization. It's not. Quite the contrary. And the second assertion that we don't have as much out, so therefore it's clearly not Ottawa's responsibility to get more, are both wrong. It is Ottawa's responsibility to get more, and I'm glad to hear the Prime Minister announce that he's getting more, because on the call with the Prime Minister last week, it was very, very clear that, like Manitoba, several other provinces now have or are ramping up capacity to get significantly more vaccines out if they have them delivered to their province. Hope that helps.
Mr. Premier, I understand, though, that while Manitoba initially was holding back sufficient supplies for the second dose, that it had moved away from that position to a certain extent to maximize the number of first doses, especially as it was more confident of getting supplies from Ottawa. But following up on this position, a lack of having a provincial director of immunization, understood that other people would have been filling the function, but this presumes that they also had other duties. Has anyone actually done the job full-time as of yet?
2 points. I'll go to the second one first, Larry. That's a great question to ask the organization and leadership of our vaccination task force. They're instrumental in preparing our plan. They're instrumental in managing some of the HR challenges and in planning to address a number of other ones. As we ramp up further, we're going to have lots and lots of hiccups along the way. So I would just simply say, I would hope that the media isn't focused on every hiccup that happens, when the larger issue is, of course, bending the COVID curve, number one, and secondly, increasing the capacity of a brand new operation, by the way, historic in its nature, to get vaccines into the arms of people. On the first assertion, no, we're still holding back some vaccines, which, as I emphasize, other provinces have stopped doing, but we're doing it to be sure that we can, if we miss a shipment or if our supply chain breaks down, and there are lots of things that could happen, we're ensuring that we get the second vaccine into the arms of people. Now, we can't miss more than about a week's shipments, but we could miss a week's shipments and still ensure that our second round of vaccines is available to folks. And we want to make sure that we get those in, because that's the most effective way to do it. We believe right now that that's the right approach to take, but it does mean that other provinces have a higher percentage of their vaccines out sooner. And our concern is that we want to make sure that the vaccines, not just the first, but the second dose, are also available to be delivered, and that's why our plan is designed the way it is.
From Global News, Brittany.
Good morning, Mr. Premier. I know you just spoke a little bit about the vaccine and holding some of those doses back. As of yesterday, just more than 10,000 doses had been handed out of the more than 25,000 of the Pfizer specifically that we've received. Do you think we're moving fast enough and getting as many vaccines into people's arms as quickly as possible, or are we lagging behind a little bit still in what we have?
Well, again, Brittany, remember that we're working, a significant chunk of our vaccines are going out into First Nations communities. We need to have coordination at that end to make sure that's done well and properly and respectfully. And so that is a reason that some of the vaccines are taking a little longer to get out there, because it's not the same to deliver to Parliament Hill as it is to, St. Teresa Point. So there's a delay for sure in delivering to northern communities. But on the other hand, our super sites have just ramped up. So give us a break, okay? It's been 1 week since we got those. we want to do it properly and right. The teams that are working there, we feel are doing a tremendous job for Manitobans. They've ramped it up so the capacity to increase the number of vaccines every day pretty much is going up. They'll be able to share the actual numbers with you tomorrow. And I'll have another announcement tomorrow on something else that'll help us, I think, to get the vaccines more readily available. We also have teams in the planning stages already to get, when we get Moderna, the Moderna vaccine doesn't have the same refrigeration requirements. And so with the Moderna vaccine, we'll be able to do more remote work with it and rural vaccines as well. And so that's going to add in our ability to get the vaccines out to folks who, in some cases, it would be dangerous for them to have to travel to a site, for example.
Thank you. My follow-up is, do we have enough people, staff right now, or are you guys still in the process of hiring more people to do those immunizations?
That's an ongoing challenge. That's a very important point. We want to have more than enough people, obviously, in case more announcements, good news announcements, come out of the federal government about more vaccines. And so we're building the capacity for that additional potentiality so that we're able to get even faster vaccine availability out to Manitobans. So again, the vaccine team will be able to give you more detail on that, but I know that we're constantly looking for more people, and it's going to be very important to continue to pursue the HR aspects of this with ambition, and I know that the team has been doing that for some weeks now.
From the Brandon Sun, Drew.
Thank you. Mr. Premier, you've announced today expanded criteria for the Bridge Grant program. But if in 2 weeks restrictions on businesses aren't eased enough so that more can reopen, will the province provide a third round of funding to the program?
We've been designing our programs as needed to be as effective as possible, Drew, so I'll never dismiss the possibility. But I think I'll leave it to Manitobans to make the formative decisions around following the guidelines, and Dr. Roussin to make the decision on when he and his team are ready to recommend reducing restrictions before I would comment affirmative or negative on that assertion.
Okay, thank you. And just to follow up, but when the restrictions do start to ease, would you anticipate that the rollout or the rollback, I suppose, is going to be similar to what it was last spring, or will it be entirely different?
Well, I think it can only happen effectively, sustainably, if we're careful. So I'm going to say again, as much as I know that all of us would love to see an end to every restriction tomorrow, remember that these restrictions have saved lives. Hundreds of lives in our province have been saved because of these restrictions, and that is to your credit because you did the right thing. So please remember, this vaccine is not here yet. And don't make the mistake of letting your guard down. COVID will take advantage of that in a second. I'm very, very anxious about the colder weather that, well, it's been deferred for a while and we're all thankful for that, but I'm very concerned that as we get into colder weather, that people will want to gather inside. And gathering inside versus walking along the Assiniboine River or going and walking around outside at the Forks, according to Dr. Roussin, it's a lot more risky. So you can tell my concern is I don't want us to open up. I've talked to the business representatives many times on this issue. They don't want us either to relax the restrictions and then yo-yo them back up and back down again. This just creates a nightmare for the small businesses. So they'd rather, I think, see us do this sustainably and gradually. But all of us would like to see these restrictions eased. If we knew that it wasn't going to endanger one of our friends or neighbors or a fellow Manitoban, I think we'd all love to see these restrictions reduced. I want to see it done carefully and sustainably so that we can get through this together. And that's why I keep using phrases like 90 days of duty, which is now down to 78 days of duty, to get us to spring, just to get us to spring so that we can get through this thing.
From CJOB, Shane.
Hi, Mr. Premier. Thanks for taking my call. You mentioned earlier that the province is holding back some vaccine for those second doses. I'm wondering if you can let us know how many, and is it based on a percentage, or how's that being figured out?
Yeah, the vaccine team can tell you the amount, Shane. It was initially more. We're holding about half back, I'm not a medical guy, but as I understand it, as the supply chain starts to prove itself and we get more confident that we'll get the vaccines that are promised, then we're able to hold back less as a percentage. I think, and don't hold me to this, I think it's 10% or something like that, but it still gives us the assurance that if we miss a week on our shipments, that we're not going to have people miss their second vaccine. That's real important. Remember, the people we're vaccinating right now are frontline health workers working right face-to-face with people, and we want them effectively protected and vaccinated right away. The next group is your senior citizens in personal care homes, for example, or people going into a personal care home to be admitted to a personal care home. Those folks are going to get injected over the next month or so. We don't want to gamble with those folks. Out of an abundance of caution, we believe we should follow the manufacturer's recommendations, get the second vaccine in, whether it's 21, 25 days, depends on the product. This is the way to make the vaccine work the most effectively, and that's the way we're going to run our program. Unless the health officials decide to change their recommendations, that's what I've described to you, means that we're being a little more conservative than some other provinces in respect of this, who are injecting everybody right now with everything they can get for their first shot and running the risk that they may not be able to get their second shot on time, or in some provinces actually planning to give a delay to people so they don't get their second shot for a longer period, and they'll keep injecting more people with the first one. If you follow that logic, that's the status that we're in, with some provinces doing what I've just described, but Manitoba is not. We're going the safer route, and in particular right now, I think that's defensible. I agree with the task force on their recommendations on this, because we are dealing with senior citizens who are vulnerable, and we're dealing with frontline healthcare workers right now. Perhaps, this is up to the vaccination task force and their expertise, we may be looking at modifying our plans as we have previously done in the future, but I leave that up to their medical advice and expertise.
Thanks, and I guess I'll just follow up on what Josh asked about the kind of the time frame for the public health orders and whether they'll change. I'm wondering if you could give us an idea on what kind of numbers, whether it be caseloads or like hospitalizations and test positivity and stuff, that you'd be looking for to change the orders in some way.
No matter what I'm looking for, it's what our public health officials are looking for. We've kept no light between Brent Roussin and I through this entire process, and that's the way it's going to stay. So I'm following the advice of our senior health officials. I'm accountable for the decisions that are made. I'm accountable for the recommendations. And I say to Manitobans, you're accountable for following the advice. And we share that accountability. We can get through this thing together. We're all in this together. But I'm not going to start making guesstimates about what the health officials are going to be looking at for analysis. That's up to them to answer those questions.
From the Winnipeg Sun, Josh.
Good morning, Premier. This is Josh Aldridge from the Winnipeg Sun. For so much of this pandemic, the province has been messaging we have to find ways to live with COVID-19 going forward. Now that we're 10 months into this long way into the second round of shutdowns, how do you envision that we live and continue to live with this and the shutdowns and the lock and people having their public health or their freedoms restricted? How do you envision people should be trying to live with COVID-19 at this point? Is it just to stay within ourselves, not communicate with people or connect with people, to run businesses? How do you envision people are learning to live with COVID-19 at this point?
Gosh, I'm totally cognizant of the sacrifices Manitobans are making, and I'm making them too. And I respect that, and I totally believe it's important that we do that because it's our duty to protect one another. And I know it's not easy. If it was easy, I suppose, everybody'd be doing it. We've got some people who are breaking down now because COVID has really been tough on them. Or we've got some folks who believe that the rules shouldn't apply to them anymore because they just feel they've done enough now. COVID causes COVID fatigue, and COVID fatigue is real. But what we cannot do is let our guard down and let COVID fatigue start causing COVID. And that's what you're seeing right now in Ontario, where they're talking about significant new restrictions, additional restrictions, and Quebec, where they brought in a curfew, right? So when people let their guard down, COVID makes a comeback pretty quickly, and sadly, it kills people, puts people in hospital. occupies all the hospital beds, so people who need surgery for a hip or a cataract can't get it. This is what the reality of the situation is. And so, as hard as it is, it's critically important that we remember that these sacrifices we're making are saving lives, maybe our own. And so I remind Manitobans of that, as hard as it may be. Every generation has its challenges. We have ours now. This is it, right now, COVID. And hang in there, do the best you can, and respect the public health orders, because the problem isn't the public health orders, it's our willingness to respect them. And when people stop respecting them, as is happening in some parts of Canada right now, people die because of that. Thanks to Manitobans for respecting those orders. Thanks to Manitobans for making the sacrifices necessary to help keep our friends and families alive in our healthcare system there.
Thank you for that. And I want to ask you about the enforcement numbers that came out today as well. There's still quite a few people who are being fined for gathering in homes. I think there's 22 this past week, and up over $1 million in total fines at this point. There's over 72,000. Are people? Is enforcement effective? Are people actually getting the message through enforcement? Are there things you would change about the way enforcement is being done? Are you happy with the results you're seeing there?
It's a good question, Josh. You know, it's one of those things that's almost impossible to prove or disprove. I just do think that we brought in these deterrents for a reason. We have deterrents for things like driving too fast and stealing from each other, and we have a chance now to save lives and not steal the lives of other people. So I think we should have deterrents for that behavior too. We do, and we've had enforcement stepped up, that's true. I've heard people say that there's too many warnings on the one side and not enough tickets being given out. I've actually heard premiers say that in their own jurisdictions. We're trying to be fair. We tried for months to use education. It seemed to work for a while. Then we let our guard down. And quite frankly, it was, about 80% of the time since this thing started, Manitobans have been doing all the right things, and it shows. But around Thanksgiving, and I said it in my year-end interviews, Josh, that I regret that we didn't step up with enforcement and fines a little bit sooner, because I think that it might have helped get the message out we were serious about this. But at the end of summer, a lot of Manitobans let their guard down, and you saw the numbers. And we went into triple figures on October 20th, if I recall, and we hope to get out of them soon.
From CBC Manitoba, Bart.
Mr. Premier, we've seen a shift in the burden of the pandemic the last few weeks, largely from Winnipeg to remote communities, largely from all Manitobans to particularly Indigenous Manitobans. Aside from devoting more vaccines to the Indigenous community, what, from a policy perspective, can be done to prevent further spread among the Indigenous population?
It's a really important question. The percentage of active cases, I have my numbers from yesterday from the First Nations Pandemic Response Coordination Team. The active cases in Manitoba, percentage of the total population Indigenous, is now 61%. This is a significant challenge, and I want to say two things on this. Remember, these cases aren't rising because of a lack of effort by First Nations leadership. Our First Nations leadership throughout most of the province, throughout the entirety of the pandemic, has been exemplary and really steadfast in trying to prevent COVID from getting into their communities. But we can't let our guard down. And so I raised the issue in respect of the Peguis chief before Christmas. Don't start celebrating and running victory laps and letting your guard down, because if you do that, there's going to be problems. Now, he'll claim there aren't problems, but the problem is the lack of leadership that shows. Because what that says is provincial health orders don't matter to me. I'll do what I want. And we have dozens and dozens of First Nations communities. If they take that approach, then we've got an even more serious problem than we have now. And I don't want that, and I don't think most of the First Nations leaders want that either. So I think that this is where we have to remember that prevention is the best cure on COVID, and that social distancing rules matter, and that following public health orders matters. And we have to remember that when we're mobile, we're taking COVID with us potentially. So we have to limit our number of contacts. These fundamental things are key in our northern communities, as they are in every community of our province. And so it's important going forward to remember we're all in this together. This COVID doesn't discriminate, neither can we. And so we must continue to be diligent in terms of the preventative work that Brent Rooston has led, but that most of the chiefs and communities have followed with really incredible dedication throughout this entire pandemic.
Shifting back to vaccinations, we have seen the federal government repeatedly claim that there will be enough vaccines to get in the arms and fully immunize all eligible Canadians by September. Your government has projections based on expected Moderna and Pfizer shipments that all eligible Manitobans will not be vaccinated this year. What is realistically the middle ground there?
Again, that's a question for the vaccination team. I asked the question because I want us to be over-prepared, I suppose. Some weeks ago, can we build our capacity up so that we have the ability in case we get good news? I don't want us to have to be dispensing vaccines more slowly than the availability. I'd rather that we were more than ready for the delivery of the vaccines, and that's what I'm assured we are now able to say. And so we will be able to deliver more vaccines sooner if they come. But as far as the projections, I'll ask you to ask the vaccine team for their rationale.
From the Steinbach Carillon, Josh.
Mr. Premier, it looks as if there will be another protest against restrictions in Steinbach this weekend. What would be your message for the protesters?
Well, it'll be the same message I've been given from the start, Josh. Like, just you got the right to protest. Other people have the right to breathe. So make sure that you distance properly while you're protesting, that you respect the public health orders. If there are orders against assembly over certain numbers, don't break those orders. Follow the rules. You don't follow the rules, you're going to pay a fine. You know, we're all in this together. I get that people are frustrated. I'm frustrated too. The fact of the matter is, we are going to get through this together if we stay together and follow the public health orders. So let's follow the public health orders.
I have nothing further.
To you, Josh, while you're on, and all the other Joshes too on this call, that we are, and this is relevant to Southeast Manitoba, we've got a long-standing deal with the federal government that would allow people to get health care over in Moore Road and then come back home. And the federal government started introducing this more severe restrictions on the folks in Piney in that area down there. Our MLAs raised this. We're real concerned about it. We raised it with the federal government. We're continuing to raise it. We don't feel that's fair or right. We are very concerned that folks shouldn't be deterred from getting their health care the way they have been getting it in closer proximity. It's a distance, you know, for folks from Piney to have to come into the city of Winnipeg, for example. And so I raised this one on behalf of the people of Southeast Manitoba, so they're aware we're thinking of them, and we're really fighting hard to get the federal government to make some decision, please, on this issue. If they would let us allow the folks who need to go for health care across the U.S.-Canada border, it just seems to me to make good sense, and it would just show some compassion for the folks in that area. So we'd like to see that happen, and we're working very hard to get an answer out of the feds.
Our final reporter, Mr. Premier, will be from CBC National News, Cameron.
Good afternoon, Premier. We're starting to see some calls around the country for provinces to get involved in covering off paid sick leave. Many people are starting to complain that the Canada Recovery Sickness Benefit just isn't adequate anymore. In your mind, is that federal program still effective? And have you contemplated paid sick leave here in Manitoba beyond the job protective leave legislation that you introduced?
Well, as you know, Cameron, I was one of the premiers that, along with Premier Horgan, Premier Silver from Yukon, from BC and Yukon, respectively, that advanced the idea of paid sick leave for this pandemic period to offer assurance to folks that if they to discourage folks from going to work sick because they felt they had to, and to encourage them to go and get tested, and to encourage also a healthier workplace and a healthier population. So we want to see the programs designed in such a way that they work. But maybe you'd like to elaborate on what the specific suggestion or recommendation was that you alluded to, that people said it didn't go far enough, because I'm not clear on that.
Yeah, well, we're starting to hear from people that $500 for 2 weeks, so $1,000 over a 2-week period, isn't enough for some people that have to perhaps take care of a family member. We're also hearing from some medical associations that basically provincially paid sick days may be an incentive to help keep people at home that feel that, that perhaps still feel like they're sick but need to go and need to work. Is it time to consider a program like that?
Well, as you well know, with every program there are consequences, and then there are that are intended, and there are consequences that may be unintended. You've alluded to the possibility of discouraging people from being at work. I suppose that's a potential possibility. My rationale for advocating for this program in the first place was to provide a base level of support to folks, not to give them income substitute or income replacement in many cases. And so, it's a tough one, right? The federal government agreed to take this on after extensive lobbying by myself and Premier Horgan, Premier Silver, and we thank them for that. But it's the same with the CERB program. There are people who say, well, the CERB program should offer me more every week because I need more money to live on. It's a tough one. The federal government is going into the largest, most significant deficit position in the history of our country, with some significant programs, more support programs to their credit than many other countries offer. We're doing the same in Manitoba. We're offering more support programs, for example, the ones I mentioned today, for small business than anyone else in the country. And we are going to have a record deficit this year as well. So fiscal considerations aside, some supports are essential, I think, to encourage people to make sure that they don't go to work sick, that those supports are there. And I'm not going to stop saying thank you to the federal government for listening to the premiers on this one, because I think it was a smart move.
And if I could just...
I guess I'm done here today, but I know there's an exciting announcement tomorrow. I can't tell you until tomorrow, but I also know there's lots of other good news coming for Manitoba as Manitobans continue to follow the recommendations of Dr. Roussin, and I encourage you to continue to do that. I know it's hard, but Manitobans know how to do their duty. Keep doing your duty. We'll get there together.